First of all, good morning Queensland, good morning Brisbane. So today I can report that we have 2 cases of COVID, but we are absolutely fine with them because they were in quarantine and the 2 people are in hospital. They were on board a ship, and Dr Young will explain a little bit more about that. That means we have 6 active cases. Our total number of cases is 1,160, and included in that number is a historical case, which has happened ages ago but has been added to the total, which means we've also had over 5,200 tests in the last 24 hours. Today we're very pleased to be here at Hurston. I think it was about 2 years ago we were turning the sod here on the STARS, which is the Surgical Treatment and Rehabilitation Service. It's due to open next year. I'm getting a sneak peek today with the Deputy Premier, the Minister for Education and the Chief Health Officer. And what this means is it means more beds and more surgeries. That's exactly what we want for Queenslanders and Queensland families. And there will be 5 operating theatres and another 2 operating theatres by June. So this is wonderful news. This is a fantastic precinct, and I'm very pleased that the government has been able to ensure that this happens, and we want to see those more surgeries happen and those extra beds, 182 beds, and it brings together surgery, rehabilitation and outpatient services, which is exactly what families need when we're looking after their health and we're keeping Queenslanders safe. Now, today, some more good news, and we have now put together a roadmap which takes us to the end of the year, and we're going to talk about easing some more restrictions. Now, the reason we can ease the restrictions is because Queenslanders have done a brilliant job. I want to thank all of the families out there, all of Queenslanders, for doing the right thing. Keep up the great work, but just remember too, if you're sick, stay at home and get tested. So what does that mean? So from 4 o'clock this afternoon, in some great news and in breaking news, you will be able to stand up inside and outside, whether it's a cafe, restaurant or a bar, and have a drink. Now, there's only one proviso. We want people to make sure that they are keeping up with their social distancing, but this is something that the communities have been saying to me. I've been travelling this week out at Moranbah, out up to Cairns as well, and I love to see people enjoying the lifestyle, and the only reason we can do this is because Queenslanders have done a great job, and I want to thank Dr Young, because Dr Young has provided us with that health advice which enables us to do that. Secondly, we've made it very clear that our borders have kept us safe. We are looking very closely at New South Wales, and if they do not have any community transmission for 28 days, we said very clearly that at the end of the month we review the plans, and that would mean there may be a possibility of opening up to New South Wales if there is no community transmission. But of course, their health experts are also concerned about some undetected community transmission at the moment. They're about to go into school holidays. So we will be watching that space very carefully, and Dr Young will be watching that space very carefully. In some other good news too, so stage 5 from 1 a.m. on the 1st of November would also mean that gatherings of up to 40 people in homes and public spaces across Queensland, and up to 40 people would be able to dance at weddings. We're not going to choose those 40 people. The weddings themselves will have to choose those 40 people at any one time. And then, of course, we've got stage 6 from 1 a.m. on the 1st of December, gatherings of up to 50 people, and, of course, the increase of the number of attendees permitted outside with those COVID-safe events, and unlimited dancing at weddings with the COVID-safe plan. So these are the issues that people have been raising with us, and because of the great response that Queenslanders have had, we have been able to act on the health advice. And, of course, it does depend too on making sure that we don't have any community transmission. If we do have some community transmission on the roadmap, it says there what would happen. Gatherings would be reduced in homes. There'd be increased testing, wearing of masks, and of course Dr Young would take those steps that are necessary in relation to places with a disability and hospitals where PPE would have to be worn. So I hope this gives Queenslanders confidence to get out there and enjoy their state. We've been able to do things more in Queensland because we have taken those proactive steps. We've kept Queenslanders safe, and that means now that Queenslanders can enjoy Queensland can enjoy Queensland even more. So I'll hand over to the Deputy Premier and then the Chief Health Officer.
Thanks so much, Premier. Well, we have three pieces of wonderful news today. Of course, the first is that we have just those two new cases. Both were maritime crew, one a man in his 20s, another a man in his 30s. And I think it underlines just how effective our industry COVID-safe plans have been. They've allowed us to continue with maritime freight, with road freight, while also keeping our communities safe. They're now being treated at the PA hospital, and our contact tracers are working to identify whether there is anyone at risk of infection from those cases. It means we now have 6 active cases. We did 5,256 tests in the last testing period, which is fantastic. The second piece of good news is that from 4 p.m. today in Queensland will be happy hour. We'll be able to again stand at the bar and have a drink, again stand at a restaurant or a cafe and have a snack. I want to shout out to our hospo workers. They've done a really fantastic job, and this seated restriction has been one of the hardest for them to enforce. It's been really important though. It's enforced social distancing, but it has been hard on our hospitality workers, and this will make their job a lot easier and will also make going out a lot more fun. That is part of, this announcement is part of our brand new roadmap, taking us through stages 4, 5 and 6 as we continue to ease restrictions here in Queensland. This is only possible because we've been so successful at limiting transmission. It's only possible because we managed to get on top of those recent clusters here in the Brisbane and Ipswich metropolitan areas. It's designed to give Queenslanders and businesses some certainty about where we're heading, a sense of exactly where we are heading with restrictions. Of course, things might change, but these roadmaps have been very effective and very welcome in the past. And we've always said that our health response is the foundation of our economic response. It is the first and necessary step of getting our economy open, getting businesses open again, and getting people back to work, which is, of course, our focus. Today, we've reached practical completion on STARS. So welcome to Queensland's newest public hospital building. This was a $340 million investment, delivering an additional 182 beds to what is already recognised worldwide as one of the world's biggest and best hospital campuses. We will add 7 theatres all up, 3 new endoscopy suites, 2 new CT scanners, 2 new X-rays and an MRI machine, allowing us to do literally thousands more procedures here at the RBWH within Metro North. Once the fit-out is complete, we'll begin doing those surgeries in February 2021. They'll be all up, and once we've fully ramped up, about 900 new frontline staff here delivering those surgeries. It is fantastic. It is just fantastic. As you can see, cutting-edge, world-class new health facility. It's one that we wouldn't have if this government were not elected in 2015. Campbell Newman and Deb Frecklington were planning to sell this precinct for a private hospital and for a residential apartment development. We were elected, we stopped that sale, and we've been able to deliver this fantastic new public hospital facility as well as a range of other developments that will now progressively open on this site. It underlines how governments matter. It underlines how who you elect matters. If Campbell Newman had been re-elected in 2015, we would not be standing here in this new public hospital building. And if Deb Frecklington were to be elected Premier, we would not see new public hospital facilities like this. We would see cuts to public hospital services, cuts to nurses, just like we did the last time the LNP were elected.